So Karen, go ahead and get started. Karen, we're to you.
Hello and welcome to today's webinar on incontinence. I'm Karen Platzer, the Director of Marketing at Clark-Lindsey, and we are glad you could join us for this informative webinar. Now, before I introduce our speaker, let me just take a little bit of time to tell you about Clark-Lindsey, in case you're not familiar with us. Clark-Lindsey's been around since 1978. We are the area's only life plan community, which means we offer the whole continuum of care. We have 131 independent living apartments and villas. We're situated on 27 acres right next to the beautiful Meadowbrook Park in Urbana. Many amenities are included for residents, like restaurant-style dining, housekeeping services every other week, flat laundry service, chauffeur service, access to our extensive library, art center, hobby center, solarium, resident gardens, indoor pool, fitness center, and many classes, programs, and events. Currently, we have 2-bedroom apartments available. You can stop by anytime for a tour, or you can give us a call and schedule an appointment. Now, residents also have full access to our Meadowbrook Health Center, which offers short-term and long-term skilled care. Our greenhouse homes, one home provides assisted living with a memory care designation, and our other home offers skilled care. And Renewal Therapy offers both inpatient and outpatient therapy. New patients are welcome. Outpatient therapy is open to all ages and includes aquatherapy, occupational therapy, physical therapy, speech therapy. And today's speaker is the Director of Renewal Therapy, Sandra Jones. Sandra joined Clark-Lindsey in 2019, bringing with her a breadth of experience as an area occupational therapy assistant and therapy director. In her position at Clark-Lindsey, Sandra facilitates interactions between therapy staff and other departments, coordinates care with residents and their families, and plans and schedules resident treatments. Sandra has dedicated her continuing education on strategies to manage incontinence over the last few years. Without further ado, here's Sandra.
Hello, everyone. Welcome to the webinar today on managing incontinence. So we are going to talk about a topic that is not talked about very often, and sometimes it's hard to bring up. But I want you all to know that this is confidential. No one knows that you're attending this meeting. So any questions that you have can be entered into the question chat box, and we can answer those questions, but it will be anonymous. Also, if anyone has any questions outside of this, I will always be able to be available to you at any time to answer those questions. With that being said, we'll go on into our webinar today on managing incontinence. So managing incontinence, as you see our picture here, is kind of, like I said, hush hush. But more than 13 million people in the United States, both male and female, young, old, experience incontinence for many different reasons. And statistics show that women experience incontinence twice as often as men. There was a study where more than 13 million people in the United States, male and female, were asked how often they have incontinence. And women experience incontinence twice as often as men, for reasons like pregnancy, childbirth, menopause, and the structure of the female urinary tract compared to the male urinary tract. So in this webinar, we'll go through some of those reasons and how to manage your incontinence throughout your day-to-day life. So part of that study was women that were tested. So, and these are just numbers that I want you guys to see, just to know that it is okay to talk about this, but not everyone feels comfortable to. Well, now we're here today to make that topic a little bit more comfortable to talk about. So of all of the women that were surveyed, 23.5 million women answered the survey. 20,000 men answered the survey. So we know that women have it twice as often, but they're also a little bit more willing to talk about it than men. But I want to help make you guys all comfortable by answering some questions throughout this webinar. So Sarah, if you can launch the first webinar questions. These are all yes and no questions. Again, nobody sees the answers to the questions. It will just be pulled by a percentage. So the first question is do you usually get a strong urge to urinate? Yes or no? The second question is, do you always make it to the bathroom in time? That's okay if you don't. And the third question is can you overcome the urge to void? So don't feel shy. Go ahead and answer. We'll get some live results as we continue to see the polls come in.
I'm going to give it about 10 more seconds here as things are coming in.
And remember, it is anonymous. No one can see your results.
Okay, I'm going to go ahead and end this poll now, and we'll take a look at the results. We'll share the results so that you can see that, Sandra.
Sure. So here are some of the results. 73% of you said, yes, you usually have a strong urge to urinate. 27 of you said no. And number two, do you always make it to the bathroom on time? 82% of you said no. So stay tuned through the webinar. We'll be able to teach you some techniques of maybe decreasing that percentage. And then number three, can you overcome the urge to void? 73% of you said no. So we will continue with our webinar. There will be other questions throughout the webinar, so we'll be able to pull and answer some more questions as we move along. All right. So the causes of incontinence. Incontinence is often seen as part of aging, but it occurs for many other reasons. So some of those reasons could be a urinary tract infection, a vaginal infection, constipation, maybe some of the side effects of some medication you're on. So there are always many ways to kind of determine that. And by talking to your provider can help, and also talking to a therapist to kind of get an idea of what is happening. So some of those causes could be a weak bladder muscles. So just like all the other muscles in our body, our pelvic floor has muscles. So we'll go into those in a little bit to review of how those muscles are important when it comes to incontinence. Overactive bladder muscles. So at the same time where you may have a muscle spasm in your leg, you could get a muscle spasm in your pelvic floor around your bladder that causes some leakage. Another reason is some damage to nerves. So as we know, our nerves come from our brain, and our brain gives our nerves signals. So somewhere in that trail down to your bladder, there could be a reason for your bladder not to get the signal that it's time to use the restroom. So we will go over some ways of the possible reasons that you may have some incontinence. So it does say that incontinence increases with age. So 30 to 40% of adults over the age of 75 experience incontinence. But that doesn't mean if you're under 75 that you may not. Again, there could be multiple reasons. 50 to 70% of incontinence individuals do not report it or seek help. So that's why we want to bring this topic here to you, so that way you would know how and feel more comfortable reporting it to your provider or a therapist. Some other issues that can contribute to incontinence may include some of your medical history. So if you have diabetes, it may cause your nerves in your bladder not to quite know when it's time to go or to give you the time to get there. For men, blockage from an enlarged prostate, or maybe after a prostatectomy where they remove something, then you may have some extra leakage. So there are reasons to treat men and women for managing their incontinence. Some other diseases, such as Parkinson's, or any disease that causes you not to be able to move as easily, could also cause incontinence. So we will review those types of incontinence up next. So stress incontinence is the first type of incontinence that we have here. This type of incontinence happens when your urine leaks as a pressure is put on the bladder. So for example, have you ever been exercising, coughing, sneezing, jumping, or maybe lifting a heavy object and oops, there goes a little bit of leakage and you thought, oh, I sneezed too much or I coughed too hard. So that doesn't necessarily mean that your bladder is full. That just means that you have put pressure into your pelvic area that has caused some leakage to come out. So at this time, Sarah, let's launch another poll and kind of gather some information as we continue with our webinar today. So the questions in this poll are you aware of when you leak urine? Number 2 is, can you stop the flow of urine on your own? And number 3, do you leak urine when you sneeze or cough? Remember, all answers are anonymous. So thank you for participating.
I'm going to give it about 15 more seconds here. Poll. Okay, I'm going to go ahead and end the poll here. I'm going to share the results.
All righty. So everyone that has answered yes on the webinar says that they are aware when they leak urine. So that means that you're aware of it. We can do something about it. Number 2 is, can you stop the flow of urine on your own? We're about 50-50 there. So some people can, some people can't. But I can teach you some strategies of how you can be able to do that in order to make it to the restroom on time. And number 3, do you leak urine when you sneeze or cough? So that was stress incontinence that we just spoke about. So about half and half there. Some of you could have stress incontinence based off of the answer to poll number 3 of leaking urine when sneezing or coughing. So thank you, Sarah, for that. All right, let's go on to another reason of incontinence. Urge incontinence. So you can see our picture there of her running to the restroom because she's got to get there on time. So urge incontinence is the type of incontinence that happens when you have that sudden need to urinate and are unable to hold the urine long enough to get to the restroom. So as I was saying, sometimes it's a nerve issue. So I will have a demonstration after we go over the other types of incontinence of how those nerves in your bladder work. So stay tuned. Another type of incontinence that people may suffer from is overflow incontinence. This type of incontinence happens when small amounts of urine leak from your bladder. So it's always full. So if it's always full, that pressure gets really high in there and you're gonna have to relieve yourself somehow. And sometimes it happens before you want it to, or before you get time to use to the restroom. So a man can have trouble emptying his bladder due to an enlarged prostate or something is blocking the urethra. So they often, men suffer from overflow incontinence. And the other type of incontinence that we have is functional incontinence. And I talked about this just a little bit earlier when it says that maybe you have some difficulty moving. So your bladder, your nerves, your pelvic floor could be strong, but because you may have arthritis or a new joint pain, or you are suffering from Parkinson's or any other disease, it may just take you longer to get to the restroom. So in this case, you know that you got to go, you know that you're having leakage, but you don't necessarily have the time to get there in time. So we can also help you with some strategies of how to help with functional incontinence. All right, Sarah, let's do one more poll and then I will set up for a demonstration of how those 4 incontinence issues affect your bladder. So the first question of this poll is, do you leak urine during physical activity? Number 2 is, do you leak urine in small amounts? And number 3, do you leak urine at night? So go ahead and answer your poll questions there. I'm gonna get set up here for our demonstration.
Okay, got maybe about 15 more seconds here and then we'll end the poll. Okay, I'm gonna go ahead and end the poll and share the results.
All right, so our results are, do you leak urine during physical activity? 73% of you said no. Do you leak urine in small amounts? 64% of you said yes. And do you leak urine at night? 73% of you said no. So we'll continue to go over some strategies that could help you manage your incontinence as we move forward. So I am going to make my video bigger so you guys can see what I'm doing here. Kind of tilt down just a little bit. I have some tools here that will help us. So first, I want to go over what your bladder can hold. So your bladder, this is a picture, is a cone, but we're going to pretend that it's a bladder. So this first line here is where your nerve is able to tell you that it normally says, when we fill up to here is when we have to use the restroom. This second top line is when it is too late. So when your bladder fills up and it hits this nerve, then it's not able to tell your brain that you have time to get to the restroom. So demonstration here. Oh. Together. So normal bladder with filling up with urine. So that's our normal line. So at this point, I have no leakage. My bladder is telling my brain that you have about 30 minutes to an hour to get to the restroom. We'll hold on until you get there. So then once our bladder continues to fill up and gets past that top line of, you really need to get to the restroom in the next couple minutes, otherwise your bladder muscles aren't strong enough to hold that together. So then there is where you may have some leakage, and it could be all or just a little bit. So that is how your nerves tell you when it's time to go. So for stress incontinence, we're going to fill our bladder up again. And we'll say it's just about the normal level. So you have time, you have about 30 minutes to get to the restroom. But if you accidentally cough or sneeze, then that bladder is shooken up a little bit and you have a little bit of leakage here. So that is stress incontinence. I'll let all that out. And then overflow incontinence is kind of self-explanatory. So overflow incontinence means that we have filled our bladder up to the very top, so all the way up here, and then it just starts to leak out because it's so full here at the top. But as a therapist, we can teach you with some strategies of how to help all types of incontinence. Move these items out of the way. Come back up here. All right, so let's go over some treatments for incontinence. So some of the treatments today for urinary incontinence are different than before. So now that this is a topic that is coming up, many people have been studying how to help those managing their incontinence. So the choice of treatment depends on, well, the type of bladder control that you have. So we just reviewed stress incontinence, urge incontinence, functional incontinence, and overflow incontinence. So those are the four main reasons that you may have incontinence. So talking with someone and just sharing what type of symptoms you're having will help determine what type of incontinence you have and how to treat it. So as a general rule, the simple and safest treatments should be tried first. So let's go into what those possible treatments are, or how you can change your lifestyle in order to help manage your incontinence. So losing weight can help you with managing your incontinence. It could just be a lot of weight, pressure, getting to the restroom on time. Quitting smoking can help manage your incontinence. Avoiding alcohol, drinking less caffeine. So oftentimes when I work with people on managing their incontinence, it is important to figure out what they're inputting into their body to figure out how it's coming out. Another way is preventing constipation. So as we talked about pressure in the pelvic floor area, if someone is constipated, it could put extra pressure on your bladder, causing some leakage. And then also not lifting heavy objects or placing too much strain on those pelvic floor muscles. You can also buy special absorbent underclothing that can be worn and changed daily to help protect you and your skin from the moisture. But to avoid using them, or maybe not using them as often, I have some other strategies for you. So as we said, there are different types of urinary incontinence, and there are some medical management techniques in order to help with that. So you could always ask your doctor if there are some drugs to treat the type of bladder incontinence that you are having. But also be aware that drugs also have side effects, and some of those could cause other side effects and cause the muscles to tighten or to have more leakage. You can also talk to your doctor about all of those. Your pharmacist would be able to help you when it comes to incontinence and medication. So this is how therapy's role can help you in addressing incontinence. So your doctor may suggest bladder training, which also is what the therapists do with you during your therapy sessions. So bladder training, there are a couple ways to go about it. So there is a voiding diary. So a voiding diary could help how often you are going to kind of see what the trends are. Exercise, which includes a lot of pelvic floor strengthening, core strengthening, so that your abdomen and your back muscles, and then timed voiding. So once you do a voiding diary to know how often you're going, you can kind of plan and have a timed voiding to make sure that you're emptying your bladder in time to avoid incontinence. Sarah, if we could launch one more poll here at this time, we'll gather some more information as we move forward, and then I will review those 3 therapy strategies with you. So our first poll question is, do you leak urine when you change position? Our second poll question is, do you feel you empty your bladder? And number 3, do you have to strain to empty your bladder? So feel free to answer those questions, and then we can review those results.
Okay, I'm going to give it a few more seconds here, maybe 10 seconds, and we'll end the poll here.
Okay. And remember, if you have any questions, you can enter those questions in the questions chat box. Those questions are anonymous. We can read those questions out loud and answer maybe questions that other people are thinking at the same time.
Okay, I'm in the results, and here are the results.
Right, so the results: do you leak urine when you change position? 83% of you said no. Do you feel you empty your bladder? About 50-50 there. 58 said yes, 42 said no. Do you have to strain to empty your bladder? 25% of you said yes, and 75% said no. So we'll go over some strategies of how therapy can help you. So we talked about avoiding diary. The therapist can help you organize and recognize patterns of incontinence and the task which may be associated with those. So earlier we were talking about what you intake, whether it's caffeine, tea, soda, you could be drinking water. So kind of taking a diary of how much you're putting into your body and what that item is could also affect your bladder. And some caffeine can irritate your bladder, so it may be causing you to go more often. Obviously, water is always a good choice. As your kidneys filter all of the waste in your body, it does go to your bladder, and that's how we void urine. So extra water into your body will help clear all those toxins out. The therapist can help identify factors which may be contributing to your incontinence through a personal diary. So not everybody's diary is the same. Your therapist would be able to review that with you and kind of see some trends. Are you having more incontinence in the middle of your day? Are you having more incontinence of an evening after you've had a late night coffee or tea? So if you are interested in starting your voiding log, you can do that 24 hours around the clock. Just kind of keep it close to your bathroom where you can jot down how your voiding schedule. Another way that therapy can help is by exercise. So why do I leak when I sneeze? So the increased pressure in the abdominal cavity that stress incontinence causes when you cough or sneeze, or the increased pressure because you're constipated or because your bladder is full, causes weak pelvic floor muscles. And then the result of those weak pelvic floor muscles result in leakage. So by doing exercises to strengthen the pelvic pyramid muscles, you can lessen the likelihood of leakage. So as a therapist, we work on the whole body to increase strength in any muscles that have lost their, have atrophied. So the same thing applies to a pelvic floor. So the pelvic floor is made of multiple muscles kind of sitting there at the bottom of your core. So you kind of sit on it right inside of your pelvis. Let me go to the next slide and see if we got a picture. So you may have heard the word Kegels. And as a therapist, that is not my favorite word. You probably have heard it from your doctor, from your friends. You know, if you watch TV shows, they'd say, oh, do your Kegels. But what does that actually mean? So pelvic floor muscles work on the muscles to stop urinating, but they also work on so much more. So by making these muscles stronger, you can hold urine in your bladder longer that hopefully will get you to the restroom on time. So you will also help by building up your core. So you can see this picture that we have here, that she is trying to lift her core up off of the floor to help strengthen those muscles. But again, back to Kegels, what does that actually mean? So there is a technique called the knack. And I'm not quite, I do know that it does not stand for anything. It's not an acronym, but it does, it's a system of how to help you contract and hold that contraction in order to safely make it to the restroom without having some leakage. So squeeze before you sneeze. So strengthening exercises alone will not improve incontinence. So doing that contraction and timing the contraction. So for instance, to strengthen your bicep muscle, you would curl a weight. And the higher the weight of my dumbbell, the stronger my arm will get. But the pelvic floor doesn't really have a way to hang on to a weight. So what we do here is contract with that Kegel word and hold that contraction. So at this time, I'm going to stop sharing my screen and show you a picture. Let me move back a little bit of of a pelvis. So these are your hip bones here. And then these are your femurs. So this is down to your leg. So we've cut the legs off just to show you the pelvic. So in here is the pelvic floor. So inside of there, there's a lot of muscles and there's a lot of pressure. Everything, all of your organs are there, you know, on top of it up here, and it's all putting pressure down. So imagine the sheet being your pelvic floor. So as you can see here, it's a little curved. Unfortunately, gravity sometimes makes it look like this, but we want it to be kind of up here. We know that there's going to be pressure there, but we want to strengthen that. So back to that word Kegel. What does that mean exactly? So when I think of Kegels before becoming a therapist, I just thought it means to squeeze. Well, what am I squeezing? So I want you to sit on the edge of your seat with me. Again, nobody can see you. So I'm going to show you. If you sit on the end of your seat, and I just want you to squeeze that Kegel word. Do a Kegel, squeeze. Try to focus on what muscles are squeezing. It could be all of it. It could be towards the front. It could be towards the back. Okay? Now, if you can, I want you to lean to the right. Now I want you to complete that Kegel again. Squeeze. Okay. Did it feel different than when you were sitting on the edge of your seat? Now lean to the other side. And squeeze again. And did that feel different? So as a therapist, we would be able to find out all of these muscles here at the bottom of your pelvic floor and isolate them to help you work all of them, but not just with one squeeze of a Kegel. So an individualized treatment from a therapist would help you isolate those muscles to find out which incontinence you are struggling with, and also which exercises are best for you. So we'll go back to our screen here. Alrighty. Sorry about that. All right, so the neck, the squeeze before you sneeze. So we want to make that contraction of your Kegel, but we also want to hold it. So the longer you hold it, there's that weight that, our pelvic floor ain't quite able to hang on to anything, but the weight is the timing of that contraction. So as we move forward to that pelvic pyramid, the multifundus is the blue part, or the purple part in your spine. So as everybody is maybe sitting at the edge of their seat still, try leaning back and having poor posture. So if you lean back, your spine is kind of bending in and out. So let's try leaning all the way back with poor posture and completing a Kegel. Squeeze. Good. And now come up to the edge of your seat and squeeze with a Kegel. So there, that muscle of your spine in between your vertebrae is changing. So that's also changing the way that your contraction of your pelvic floor happens. The other part is the pelvic floor, so the squeeze and lift. So the pelvic floor is the blue part, and kind of how I showed you here in our diagram. So that pelvic floor, when you squeeze and lift, comes up. So if your bladder is full, you know you got to use the restroom soon. If you squeeze that pelvic floor comes up. And then last but not least, the transverse abdominals. So that is your tummy muscles. So that is your core strength. So if you pretend that you're zipping up your pants, then kind of that sucking in of your tummy, maybe just a little bit, reaching down to get that zipper, those are those transverse abdominal muscles. So a therapist would train you in how to use the multifundus, your pelvic floor, and your transverse abdominals in contractions with timing in order to help manage your incontinence. So practicing the neck. So from a standing position, if possible, let's march in place, or you can do it in sitting. So we're marching in place. Imagine you're about to sneeze. You would stop marching and you would squeeze, Kegel, that pelvic floor, your multifundus and your transverse abdominals all at the same time. And then you would sneeze. Achoo. So instead of that impact without all of the freezing and pulling up of those muscles, you may have had some leakage. But if you try the neck, then you're able to know that a sneeze is coming, or that you're getting ready to lift something heavy, or you're getting ready to cough, and try to squeeze those muscles, engage your pelvic floor, and avoid some leakage. So by holding that contraction is really what's building up the strength of those muscles. So repeat this exercise, neck, as often throughout the day to help you with some leakage. All right, Sarah, let's launch, I think, our last poll with just a couple questions. So question number 1 is, do you have trouble starting your stream of urine? And question number 2, do you start and stop your stream of urine when voiding? Right. Results are coming in. Remember, you can always ask questions if anybody has questions.
So, Sandra, we did have a comment, I think. I'm going to pull that up real quick and maybe you can talk about that. I'm just going to give this about 10 more seconds here, but I can go ahead and go there.
Okay. So the results are coming in. Do you have trouble starting your stream of urine, and do you stop and start your stream of urine when voiding?
So I'm going to go ahead and end the poll and share the results here. And then, and while you're doing that, Sandra, oh, I guess I can't do that. I have to wait till I share the results to ask the question.
Okay.
So never mind.
So do you have trouble starting your stream? 75% of you said no, 25% said yes. Do you start and stop your urine when voiding? 58% said yes, 42% said no.
Okay, so let me get rid of this here. And then one question just was, can they get a copy? Is there a way we can share a copy of the practicing the NAC slide to the people who have participated today?
Sure. We can gladly share those techniques with you. If you participated today, we have your email. We can send it to you via email.
Okay, and then I also had I think someone just had a comment. I'm just going to say that right now. There was a comment in here that says, when I get up in the morning, I start to pee before I can make it to the bathroom. I'm not able to stop it at all.
All right, so that could be a combination of that nerve not quite telling you. So as you know, we're not always, where's my pelvic? So we're not always, you know, straight up. Sometimes we're sideways. So for instance, my bladder, let me stop sharing just for a second so you guys can see me. So sometimes my bladder is sideways. So that, and I'm not putting water in here right now. So sometimes it could be sideways. So it's not telling that nerve that it's full, but as soon as you get up in the morning, it's all the way up to the top where it's too late. So a technique could be is to do the NAC before you sit up, kind of squeeze and pull in all of those pelvic floor muscles, your transverse abdominis, to squeeze before you get up. And then once you get up, to kind of do that NAC one more time as you make it to the restroom. And breathing does have some parts to do with that NAC too. So you would always want to take a deep breath in and kind of exhale and then kind of squeeze everything, do your Kegel, your NAC, and then try to go to the restroom. Some people have said that that helps, you know, just get them there a few extra steps instead of having leakage. So that's definitely something to try. Any other questions at this time, Sarah?
Nothing yet.
Okay. We will go back to our presentation here. So we'll share that with all of the attendees. Another way to manage your incontinence is by timed voiding. So in timed voiding, you urinate on a set schedule, for example, every hour. A therapist can assist you in developing what this schedule should be based off of your voiding diary. You can slowly extend the time of those. So if you start at an hour, you know, in the privacy of your own home, extend it to 2 hours. I hear this a lot of times where it's like, I have an event coming up, or I'm going on vacation with my family. I don't want them to make a stop at every rest stop needed, so I have to use the restroom. So sometimes we're working on building up the time in between voiding, and by working on some pelvic strengthening and some awareness. So of course, when the timed voiding and the pelvic floor muscles are combined together is usually when we see our best results. All right, let's see. Some other strategies that can help you manage your incontinence is fully to eliminate your bladder. So in the last poll, we had some questions of, do you start and stop during urination? So sometimes that could mean that your flow is not as strong, and that we can work on those muscles. Maybe they're spasming and maybe they're cutting off that urine flow that doesn't allow you to fully empty. So some of the ways that you can try that to see is if you sit on the toilet a little longer, to let those pelvic floor muscles completely relax to allow all of the urine to come out while you're on the toilet. So some people use the rock and roll technique. So while sitting on the toilet, you can maybe lean sideways. Like I said, the bladder doesn't always just stand up straight. Sometimes the bladder is tilted back, forward, so you may not always feel that that urine is there at the tip ready to come out. Maybe you're tilted forward or you're leaning back on the toilet, and if you rock back and forth, that you'll be able to activate those nerves in your bladder in order to release. And then some people do double voiding. So they sit down initially, void as much as they can, and then stand back up, kind of move some stuff around in that bladder again to activate those nerves, and then sit back down again to see if they're able to empty out the rest of their bladder. Other factors to consider. So as we talked about functional incontinence, so there may be other factors in your normal day mobility that cause you to have a lengthened time to get to the restroom. So we could address balance related to ambulation to help get you there a little quicker. We could also modify the environment. So the occupational therapist would be able to go and look at your environment and kind of just make some suggestions of how to easier get around your environment and to set it up for your success. And then set some equipment like a bedside commode. If you know that you get up often at nighttime and you're not going to make it to the restroom, getting a bedside commode to put next to your bed to avoid a cleanup or avoid a fall because you're hurrying to go to the restroom may be the right piece of equipment for you.
Hey, Sandra.
Yes.
We have another comment. I thought I would just go ahead and just ask or
Sure.
say. It just says, washing my hands or washing dishes triggers voiding.
Yes, I hear that a lot. So hearing that drip, drip, drip from the fountain, from the water, does increase the need to urinate. So there is another way that you could use the NAC technique to kind of take a deep breath in, exhale it all out, contract those pelvic floor muscles, do your Kegel, and then continue with the task that you're doing. At that time, it may just be time to use the restroom. So again, doing a voiding schedule, doing a voiding log will help to determine, is it every time you hear water, or is it because my bladder's full and I haven't gone for 2 hours that I need to go while I'm washing my hands. So I encourage you to start a little diary, just kind of jotting down when that happens. So in summary, if you're living with urinary incontinence, tell somebody. It's okay to talk about it. I would say that incontinence is a taboo subject. We don't want people to know. We don't want people to know if you're using a sanitary napkin to keep, or an incontinence brief. But it's okay to talk to those people that are here to support you. So talking to your doctor, talking to a therapist, or maybe talking to your friends. You never know if I share something with my friend that he or she may be going through the same thing. So talking to those that you feel comfortable with and letting you know that it's okay to bring it up, that there are techniques to help you live a more fulfilled life. So you're not always worrying about, when am I going to make it to the restroom next? Or I'm going on a day trip, I need to know where all the restrooms are. So even if the treatment is not fully successful, having somebody be there with you to go through the process of doing a diary, giving you support and tips along the way, of how to manage it better so it doesn't feel like a burden, could also help. I know as a therapist, I have been working with urinary incontinence for the last 6 years of my profession. I've been doing this for about 15 years. First, when I started working with patients on pelvic floor, the lack of knowing what the pelvic floor is was hard. And like I said, that word Kegel has probably been on every women's talk show, has probably come up in a doctor's office, or like I said, with your friends, but never quite knew what that word meant. So we're here to help you if you have questions. If anybody has questions now, please put them in the chat box to share. I would gladly help answer some of those questions here today. We also want to thank our partners at Health Pro Heritage for getting together this data and statistics for me to share with you today. And then, does anybody have any questions that they would like to ask that I could help answer right now?
I don't see any come in yet. I will let you know if any do get added in the Q&A.
Okay.
Nothing as of right now.
All right. So once again, my name is Sandra Jones, Rehab Director here at Clark-Lindsey Village. And like I said, I've been working with incontinence for the last 6 years. No question is a silly question. Here's my contact info if you have any questions that you would like to discuss in private, or any more information on how the therapy department can help you. So I will turn it over to Karen.
Thank you, Sandra, for all of that information. Again, Sandra is the Director of Renewal Therapy at Clark-Lindsey. If you have any questions for Sandra, you can reach her at 217-344-2144. Renewal Therapy is welcoming new patients. Outpatient therapy is open to all ages and includes aqua therapy, occupational therapy, physical therapy, and speech therapy. Clark-Lindsey is also welcoming new residents in independent living apartments, Meadowbrook Health Center, and the Greenhouse Homes. If you would like more information or would like to schedule a tour, please call Clark-Lindsey at 217-344-2144. Thank you so much for joining us and have a great day.